Most people think blood pressure is all about salt, but let me tell you about something I see almost every week in the emergency department that makes absolutely no sense on the surface. I'll check someone's blood pressure and it's sitting at 160/95. A bit concerning, yes. So I ask about their diet. Oh, I eat really well, they say. Lots of vegetables, home-cooked meals. I don't add salt to anything. I ask about exercise. I walk 5,000 steps most days, sometimes more, they say. I look at their medication list. Maybe they're already on a blood pressure medication that clearly isn't working well enough. And I'm standing there looking at someone who on paper is doing everything right, and their blood pressure is still high. Here's what makes this so frustrating. They aren't lying. They genuinely are eating well. They genuinely are exercising. They've cut the salt out. They've added the cardio. They've done exactly what they were told to do. And the reward they were expecting, which is normal blood pressure, hasn't materialized. What's actually happening is that while they're restricting all the obvious things, there's a hormonal system running in the background, activated every few hours throughout the day, telling their kidneys to hold on to sodium regardless of how little salt they're eating. And most people have no idea this is even happening. I'm Dr. Alex, and over the last 10 years in the emergency department, I've become fascinated by what makes us all live longer in a healthcare system that's designed to treat disease once it's happened, not prevent it from developing in the first place. And so what I want to walk you through today is something that doesn't get talked about nearly enough in discussions around blood pressure, longevity, and metabolic health. It's not about adding something to your diet or taking something away, it's about timing. Specifically, it's about whether your body ever gets a chance to reset the hormonal systems that control pressure in the first place. Because what I've learned, both from seeing patients in the AA&E and also from diving deep into the physiology behind this, is that you can do almost everything right on paper and still end up with persistently elevated blood pressure if you're making this one fundamental mistake with how you structure your eating patterns throughout the day. So let's start with section 1 of this video. Why doing everything right doesn't always work. Let me paint you a picture of the typical patient I'm talking about. They cut out ultra-processed foods. They're not adding salt to their meals. They're walking 5,000–10,000 steps a day, sometimes more. They're eating what would objectively be considered a healthy diet. Whole grains, lean protein, plenty of veg, fruit for snacks. They're not drinking excess alcohol. They're getting reasonable sleep most nights. On paper, this person should not have high blood pressure. And yet, when we check it, the numbers are consistently above where we'd want them to be. This is really frustrating for people because they feel like they've done their part. They've read the advice, they've made the changes, and the reward they were expecting, normal blood pressure, hasn't come about. What tends to happen next is that they double down on the same approach. They cut salt even more aggressively, they add in more cardio, they try eating even cleaner, and still the readings don't budge, or they only improve a little bit. The reason this happens is because blood pressure for most people isn't purely a volume problem. If it was, then reducing sodium intake would work reliably for everyone because less sodium means less water retention, which means less volume inside the bloodstream, which should mean lower pressure. That's the traditional model, and it does work for some people. But for many others, especially those who are metabolically compromised in ways they might not even be aware of, pressure is being driven by something else entirely. It's being driven by signal persistence, by hormonal systems that are supposed to rise and fall throughout the day, but are instead staying elevated almost continuously. And when that happens, the pressure system never gets a chance to stand down. So with that, let's talk about insulin for a moment, but not in a way that you've probably heard it discussed before. Most conversations about insulin focus on quantity, how much insulin your body is producing, whether you're insulin resistant, whether your pancreas is struggling to keep up. All of that does matter, and I've mentioned this in previous videos, but it's not the whole picture. What matters just as much, if not more, when it comes to blood pressure, is the pattern of insulin secretion throughout the day. Insulin is designed to be pulsatile. That means it's supposed to spike when you eat, do its job of moving glucose into your cells, and then fall back down to baseline levels once that job is complete. That rise and fall is not just about blood sugar control, it's a signal to multiple organ systems in your body about what state you're in at that time. When insulin rises, it tells your kidneys to hold on to sodium, it tells your sympathetic nervous system to stay slightly more active, it tells your blood vessels to be in a certain mode of reactivity. All of that is completely normal and appropriate when it's happening in response to a meal and then resolving a few hours later. The problem arises when insulin never falls. When it stays elevated for 12, 14, or even 16 hours a day because you're eating or drinking something that stimulates insulin secretion every 2 to 3 hours from the moment you wake up until the moment you go to bed. Modern eating patterns have made this the default for most people. Breakfast, mid-morning snack, lunch, afternoon snack, your evening meal, evening snack, then maybe supper before you go to bed. None of us are ever hungry these days. Even if every single one of those eating occasions is healthy, even if you're choosing whole foods and avoiding processed foods, you're still triggering insulin release 6 or 7 times a day. And because those eating occasions are spaced closely enough together, insulin never fully returns to baseline before the next one arrives. Now, what that creates is a state of chronic low-grade insulin elevation, not quite high enough to cause immediate symptoms, not high enough to show up as diabetes on a blood test, but high enough to fundamentally change how your kidneys, your blood vessels, and your autonomic nervous system behave over the course of weeks, months, and years. Now, research published in the Journal of Clinical Endocrinology and Metabolism has shown that even in non-diabetic individuals, frequent eating episodes throughout the day results in sustained insulin elevation that prevents the normal dial pattern of insulin secretion. Now, a hormone that never falls behaves very differently from one that rises briefly and resolves. When insulin is chronically elevated, even at modest levels, the kidneys interpret that as a continuous signal to retain sodium. The sympathetic nervous system interprets it as a signal to maintain a higher baseline level of activity. The endothelium, the inner lining of your blood vessels, doesn't get the periods of relaxation it needs to maintain proper flexibility. All of these things individually nudge your blood pressure upwards. Combined, they create a situation where your blood pressure stays elevated, even when volume isn't particularly high, even when you're not eating excess sodium, even when you're doing most of the other things we associate with cardiovascular health. And just really quickly, if you're getting some value from this video so far, then please consider subscribing to the channel. It really helps these videos reach more people like you. Anyway, let's bring this down to the level of the kidneys, because this really is where the rubber meets the road when it comes to blood pressure regulation. Your kidneys are incredibly sophisticated organs, but they don't have eyes. They can't see whether the food that you just ate came from a health food shop or a fast food restaurant. What they respond to are hormonal signals. Specifically, when insulin levels are elevated, the kidneys receive a very clear instruction: retain sodium. Now, this happens through a very specific mechanism in the nephron, which is the functional units of the kidney, where insulin directly influences sodium reabsorption in the proximal tubule and the collecting duct. Work published in Hypertension, which is the journal of the American Heart Association, has demonstrated that insulin directly stimulates the epithelial sodium channel in the kidney, collecting duct, leading to increased sodium reabsorption independent of dietary sodium intake. This is not a design flaw, it's actually a very clever evolutionary mechanism. The thing is, when you eat, especially when you eat carbs, your body anticipates that you might need to maintain blood volume to support digestion, nutrient absorption, and the metabolic work of processing that food. Holding onto a bit of sodium temporarily makes perfect sense. The problem is that this mechanism was designed for a world where eating was intermittent, where there were long stretches between meals, and where insulin had plenty of time to fall back down before the next eating occasion. In that context, the sodium retention is temporary. It's self-correcting, and it doesn't cause any long-term problems. But when insulin is elevated continuously, that temporary sodium retention becomes permanent. The kidneys stay locked in retention mode, holding on to sodium regardless of how much you're consuming through your diet. This is why some people can follow a very low sodium diet and still have persistently high blood pressure. It's not that sodium isn't important, because it is. But if the hormonal signal telling the kidney to retain sodium is always on, then cutting dietary sodium is a bit like trying to empty a bathtub while the tap is still running. You might slow the rate at which the bathtub fills, but you're never going to get it empty as long as that tap stays open. This also explains something else that confuses a lot of the patients I see. They'll come in with blood pressure that's higher in the morning than it is in the evening, or they'll have seemingly random spikes that don't correlate with anything obvious like stress or exertion. What's happening is that their insulin levels are fluctuating throughout the day in ways that aren't obvious to them, and the kidney is responding accordingly. A late-night snack, even something as innocuous as a piece of fruit or a handful of nuts, can keep insulin elevated throughout the early morning hours, which means the kidney is still in sodium retention mode when they wake up. That shows up as morning hypertension, and most people have no idea why it's happening because they think they've been doing everything right. All of this brings me to a point that I think is really underappreciated in discussions about blood pressure and metabolic health more broadly. We tend to use body mass index and visible fitness as proxies for metabolic health. If someone has a normal BMI, if they're exercising regularly, if they look fit, we assume that their internal metabolic machinery is functioning properly. And very often that assumption is wrong. What we're learning more from sophisticated imaging and metabolic testing is that there's a significant subset of people who have what researchers call metabolically obese normal weight, or TOFI thin, outside fat, inside TOFI. These are individuals who by external appearance and BMI look completely healthy. But when you do a CT scan or an MRI scan, what you find is that they have excessive visceral fat, fat that's packed around the internal organs, particularly around the liver. And that visceral fat is metabolically active in a way that subcutaneous fat, the fat that you can pinch under your skin, isn't. A study in the journal called Obesity Research involving over 3,000 participants found that approximately 1 in 4 people with normal BMI had metabolic abnormalities typically associated with obesity, including insulin resistance and hypertension. Visceral fat releases inflammatory signals. It interferes with insulin signaling in the liver. It contributes to liver insulin resistance, which is one of the primary drivers of chronically elevated insulin levels throughout the day. You can have a normal BMI, you can be running marathons, and you can still have a fatty liver that's making you insulin resistant. When that happens, your pancreas has to produce more insulin to achieve the same level of blood sugar control. That elevated insulin then drives all of the downstream effects that we've just been talking about: sodium retention, sympathetic activation, and endothelial dysfunction. And the result is higher blood pressure that seems to come out of nowhere. This is particularly common in certain populations. Women going through the menopause, for example, tend to see a shift in body composition, where they lose muscle mass and gain visceral fat, even if their overall weight stays the same. People who are chronically sleep deprived accumulate visceral fat more readily than people who sleep well, even when calorie intake is controlled. Moderate alcohol consumption, which a lot of health-conscious people consider harmless, contributes to fatty liver and insulin resistance. Chronic stress elevates cortisol as well, which preferentially deposits fat in the visceral compartment. All of these factors can create a situation where someone who looks fit and thinks they're doing everything right is actually running on the wrong hormonal settings when it comes to blood pressure regulation. The clinical implications of this are quite profound. It means you cannot judge someone's blood pressure risk just by looking at them. It means that normal weight is not the same thing as metabolically healthy. And it means that if you're doing all the right things on the surface, but still struggling with elevated blood pressure, the issue might not be what you're eating or how much you're exercising. It might be the internal metabolic environment that's been quietly deteriorating without obvious external signs. So let's name this mistake explicitly, because up to this point we've been building the physiological case, but I want to make sure this lands in practical terms. The one mistake that most health-conscious people make, the mistake that keeps blood pressure elevated even when they're eating well and exercising and doing most things right, is constant feeding. It's eating or drinking something that stimulates insulin secretion frequently enough throughout the day that insulin never drops back to your baseline. That's it. That's the mechanism that's driving persistently elevated blood pressure in a huge number of people who would otherwise be considered metabolically healthy. This shows up in a few different ways. The most obvious is grazing, eating small amounts of food continuously throughout the day, because you've been told that keeping your blood sugar stable or stocking your metabolism requires frequent meals. Well, the research argues that it doesn't. What it does require is giving your body long enough breaks between eating occasions for insulin to fall, for the kidneys to release sodium, for the sympathetic nervous system to downregulate, and for your blood vessels to relax. When we're eating every 2 or 3 hours, none of that happens. The less obvious version is liquid calories. A smoothie mid-morning, a protein shake after your workout, a glass of orange juice with lunch, or a couple of glasses of wine in the evening. Each of those individually might seem harmless, and in terms of calorie content or even nutrient quality, they might be perfectly reasonable, but from an insulin perspective, they're all stimuli. They all trigger insulin release, and they all prevent insulin from falling. The fact that they're liquid makes it even worse, because liquid carbohydrates and liquid proteins are absorbed much faster than solid food, which means that you're getting a sharper insulin spike and a longer tail of elevated insulin after that drink is finished. Then there's the category of healthy snacks. A handful of almonds, a piece of fruit, some rice cakes with almond butter. Again, none of these are bad foods. In fact, they're quite healthy. But if you're having them between meals, if you're extending the insulin elevated window, you're preventing your body from entering the fasted state where a lot of the beneficial metabolic recalibrations happen, where insulin falls, where growth hormone rises, where autophagy kicks in, and crucially for our purposes, where the kidneys get the hormonal signal to release sodium and allow pressure to drop. Late night eating is particularly problematic because it extends insulin elevation into the hours where your body is supposed to be in deep metabolic rest. When you eat close to bedtime, even something small, insulin stays elevated for several hours after. What that means is that your kidneys are retaining sodium overnight. That means your sympathetic nervous system isn't fully downregulating during sleep. That means your blood vessels aren't getting the overnight recovery period that they need. Over time, this creates a situation where your baseline blood pressure is set higher than it should be, and you wake up every morning already starting from an elevated position rather than from a true physiological baseline. The common thread of all of these patterns is frequency. It's not about eating too much food. It's not even necessarily about eating the wrong foods, though food quality obviously matters. It's about never giving your body a long enough break from insulin secretion for the pressure regulating systems to reset. And because insulin is invisible, because you can't feel it rising and falling in a way that you can feel hunger or fullness, most people have no idea this is even happening. They think they're being healthy by eating regularly, by avoiding long gaps without food, or by having nutritious snacks, but they're inadvertently keeping the very systems that control their blood pressure in a state of chronic activation. And here's what makes this particularly insidious in the modern world. We live in an environment that's been specifically engineered to make constant feeding the default. You can get food delivered to your door in minutes. Every shop you walk into has walls of snacks deliberately positioned at eye level and at the checkouts. Snacking isn't just available. It's been normalized to the point where not eating every few hours is considered strange. Even the healthy options, the protein bars, the nut packs, the dried fruit, the granola, all of these are designed for convenience, packaged for portability, marketed as essential fuel for your busy day. The infrastructure of modern life has been built around the assumption that we should have constant access to food and that we should be eating regularly throughout the day. But our hormonal systems weren't designed for this. They were designed for a world where eating required effort, where food wasn't constantly available, and where long gaps between meals were completely normal. It used to be okay to go hungry for a few hours, but what we've done these days is create an environment where the path of least resistance leads directly to the pattern that drives metabolic dysfunction. You have to actively swim against the current of modern food culture to create the eating patterns that allow your hormonal systems to reset. And most people don't even realize they need to. So what's the solution? Well, I want to frame this very carefully because I'm not advocating for extreme dieting. I'm not suggesting that you need to go keto or fast for days on end. And I'm certainly not suggesting that any single dietary approach is right for everyone. What I am saying is that if you want to fix one of the underlying drivers of elevated blood pressure, which is chronic insulin elevation, then you need to create windows of time during the day when insulin can genuinely fall. Not just lower than it was an hour ago, actually low, back to baseline. And that requires eating in a way that allows those windows to exist. The simplest version of this is condensing your eating into a narrower window during the day. If you're currently eating across a 16-hour window from 7 o'clock in the morning until 11 at night, then try bringing that down to 10 or 12 hours. That might mean skipping the mid and morning snack, having your first meal at midday instead of at breakfast, or cutting out the evening snack and finishing dinner by 7. The exact structure matters a lot less than the principle, which is to create a continuous block of time, ideally 8 to 12 hours, where you're not consuming anything that stimulates insulin. Research published in Cell Metabolism demonstrated that restricting eating to a 10-hour window, even without changing what people ate or how much they ate, resulted in significant reductions in blood pressure, improvements in cholesterol profiles, and better glucose regulation. During that fasting window, insulin falls. When insulin falls, the kidneys receive the signal to release sodium, sodium excretion increases, blood volume normalizes, and then your pressure drops. At the same time, the sympathetic nervous system downregulates because it no longer has the persistent insulin signal telling it to stay activated. The endothelium gets a chance to produce nitric oxide without interference, which allows your blood vessels to relax. All of these changes happen automatically once the hormonal environment is right. You don't have to do anything actively to make them happen. You just have to stop preventing them from happening. Movement timing also matters, though probably not in the way that most people think. Exercise is beneficial for blood pressure, we know that, but the benefit isn't just from burning calories or improving cardiovascular fitness. A significant part of the benefit comes from the way that exercise acutely improves insulin sensitivity. When you exercise, particularly when you do any of the resistance training or moderate to high intensity cardio that we've mentioned before, your muscles become more receptive to insulin for several hours afterwards. Studies in the Journal of Applied Physiology have shown that a single bout of moderate exercise can improve insulin sensitivity for up to 48 hours. That means you need less insulin to achieve the same level of blood sugar control, which means lower overall insulin levels, which means less sodium retention and lower blood pressure. Timing your largest meal or your carbohydrate intake around exercise takes advantage of this window of heightened insulin sensitivity and minimizes the duration of insulin elevation throughout the rest of the day. As I've mentioned many times before, sleep is another non-negotiable piece of this puzzle, and I mean that quite literally. You see, sleep is when your body performs most of its hormonal recalibration. Growth hormone rises during sleep, cortisol drops to its lowest levels in the early parts of the night, insulin sensitivity improves with adequate sleep and deteriorates dramatically with sleep deprivation. There's lots of research showing that just 4 nights of sleep restriction reduced insulin sensitivity by approximately 30% in healthy adults. If you're chronically undersleeping, even if you're doing everything else right with your eating patterns, you're fighting an uphill battle because your baseline insulin resistance is higher, which means you need more insulin to control blood sugar, which means more sodium retention and higher blood pressure. At the end of the day, sleep is not just rest, it's active metabolic repair, and you cannot optimize your blood pressure without it. Let me bring this back to what I see clinically, because I think it really helps to ground the physiology in actual patient outcomes. So I've had patients come through the emergency department with blood pressure readings that are genuinely concerning. Systolic pressures in the 160s and 170s, sometimes even higher, who are already on 1 or 2 antihypertensive medications that clearly aren't doing enough. When we dig into their history, what we often find is that they're eating genuinely healthy diets by conventional standards. They're active, they're managing stress reasonably well, but they're eating constantly throughout the day. Breakfast, snack, lunch, snack, dinner, snack, sometimes a protein shake or a smoothie in there as well. Well, what that means is that insulin is elevated for 14-16 hours a day, and the kidneys never get a chance to offload sodium. What's remarkable is how quickly things can change when the eating pattern shifts. I've seen patients who make no changes to what they eat, no changes to their exercise routine, no changes to their medication, but who simply compress their eating into an 8 or 10-hour window and their blood pressure drops within a few weeks. But that's not a placebo effect. That's not a random variation. That's the kidneys finally getting the hormonal signal to release sodium, the sympathetic nervous system downregulate, and the endothelium regaining its ability to produce nitric oxide and relax their blood vessels. The other thing I see, which I think is incredibly encouraging, is that when people address the underlying hormonal driver of their hypertension, their medications start working better. If you're on an ACE inhibitor or an ARB or a diuretic, those drugs work by interfering with the mechanisms that raise blood pressure. But if the root cause, which is chronic insulin elevation, is still present, you're essentially asking the medication to fight against a continuous upstream driver. It's like trying to bail out a boat while someone's still pouring water into it. When you fix the insulin problem, the medications don't have to work as hard, which means you get better blood pressure control with the same dose, or in some cases, you can reduce the dose or even come off the medication entirely. I want to be very clear that I'm not suggesting anyone stop taking their medication without talking to their doctor. It's not safe and it's not something I would ever recommend. But what I am saying is that medication and lifestyle are not mutually exclusive. They work better together. And if you've been on medication for a while and your blood pressure still isn't where it should be, then it's worth asking whether chronic insulin elevation might be the missing piece of the puzzle. Because if it is, that's something you can address through eating patterns, and the impact can be really substantial. So before we wrap up, I just want to touch on why this matters beyond the blood pressure number itself. The thing is, elevated blood pressure isn't just a number on a monitor. It's a direct measure of the mechanical stress that your cardiovascular system is under every single day. When pressure is chronically elevated, your heart has to work harder to pump blood around your body, which over time can lead to left ventricular hypertrophy or thickening of the heart muscle, which reduces the heart's efficiency and increases the risk of heart failure. Your blood vessels have to withstand higher pressures continuously, which damages the endothelium. It promotes atherosclerosis and increases the risk of a heart attack and a stroke. Your kidneys are exposed to higher pressures, which accelerates kidney damage and increases the risk of chronic kidney disease. All of that is well established. What's less well appreciated is that the mechanism driving elevated blood pressure, which is chronic insulin elevation, sympathetic overactivity, and endothelial dysfunction, are the same mechanisms driving a whole cascade of other metabolic diseases: type 2 diabetes, fatty liver disease, polycystic ovary syndrome, Alzheimer's disease. A meta-analysis published in Diabetes Care examining data from over 100,000 participants confirmed that insulin resistance is independently associated with increased risk of cardiovascular disease, even in patients without diabetes. These are not separate conditions that happen to occur together by coincidence. They are different manifestations of the same underlying metabolic dysfunction, and that dysfunction is fundamentally about hormone dysregulation, particularly around insulin. When you address the root cause, when you fix the insulin problem by creating proper fasting windows and allowing your hormonal system to reset, you're not just lowering your blood pressure, you're reducing your risk of essentially every major chronic disease that shortens lifespan and degrades quality of life as you age. That's the real prize here. Blood pressure is the thing we can measure easily. It's the thing that gets people's attention, but the benefits extend far beyond the cardiovascular system. You're improving metabolic flexibility, you're reducing systemic inflammation, you're enhancing cellular repair mechanisms, you're improving sleep quality, you're optimizing hormone production. All of those things feed back into better health across every system in your body. So let me bring this full circle. Blood pressure doesn't stay elevated because you're eating the wrong ingredients necessarily. It doesn't stay high because you're lazy or because you lack willpower or because you failed at some moral level to care for yourself. It often stays high when the hormonal system that controls pressure never gets a chance to reset. And for many health-conscious people, the reason those systems never reset is not because they're doing the wrong things, it's because they're doing the right things at possibly the wrong frequency. You can eat whole foods, you can exercise, you can manage stress, you can have reasonable sleep, and still have persistently elevated pressures if you're eating or drinking something that stimulates insulin every 2 to 3 hours throughout your day. Because when insulin is chronically elevated, your kidneys retain sodium regardless of how much salt you're eating, your sympathetic nervous system stays activated regardless of how calm you feel, your blood vessels lose their ability to relax regardless of how fit you are. And all of that shows up as high blood pressure that seems resistant to all of the conventional advice. The solution is not more restriction, it's not cutting out more foods or adding more cardio or stressing about every single thing that you eat. The solution could be giving your body the time it needs to reset, creating windows during the day when insulin is genuinely low, when the kidneys can release sodium, when the sympathetic nervous system can downregulate, when the endothelium can do its job properly. That might mean compressing your eating into a narrower window. It might mean cutting out snacks between meals. It might mean finishing dinner earlier and not eating anything until the next day. The exact approach will vary from person to person, but the principle is still the same. Fix the signal timing and the pressure system can finally stand down. And so after all of that, if you found this video useful, then please subscribe to the channel and let's help as many people as possible.